home healthcare and hospice-related services throughout the entire DFW Metroplex. Our second sponsor is Dallas Renal Group, a physician group that Dr. Samir Nangia and I belong to. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis service. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. This is Dr. Kashif Chaudhry, and I'm co-hosting today's show with Dr. Samir Nangia. We are live in the studio with Dr. Matthias Solomon discussing Mommy Makeover. The number to the studio is 972-235-5555. To be part of the conversation and to ask questions, please call. Dr. Solomon, can you please tell us about different locations where you are currently practicing?
Okay. My main office is here in Dallas on Central Expressway. It's exactly at the southwest corner of 75 and 635.
Great. And is there a website that you can tell us about?
Yes, it's Solomon, Solomon, plasticsurgery.com.
Great. So we had a great first half of Doc Talk Live. Thanks for calling in. And again, if you want to be part of the conversation, the number is 972-235-5555. Again, 972-235-5555. And we're talking about Mommy Makeover. So one important question that I know a lot of people who are listening is, how long do these results last for a tummy tuck? And can liposuction be combined with this procedure? And is this necessary to have?
Okay. The first question, how long the results last? As long as somebody does not gain significant amounts of weight, and what I mean by significant is not more than 10, 15, maybe 20 pounds, the results really are permanent because all the skin from the pubic area to the belly button is completely taken out and the rest of the skin is pulled down. So unless you gain a lot of weight after the operation, you really can't mess up the result. The muscle is tightened, and again, unless it's a pregnancy afterwards, the tightening of the muscle will remain. The next question was, is it necessary? The best example I can give would be similar to braces. When your children have teeth that are not straight, it's not going to affect their function. They can still eat, they can still digest their food, but it's more of a cosmetic thing. So in a similar fashion, there are some women who really don't care about the excess skin and the way the abdominal contour looks, but there are many others who care. So really it comes down to, if it bothers you, you do it. If it doesn't bother you, just let it be.
This is Doc Talk Live. Please call 972-235-5555 to be a part of the live show. Dr. Solomon, what is the 3D tummy tuck, and what happens if a woman has another childbirth after the procedure?
So 3D tummy tuck is something which I personally trademarked. It's actually in the process. A traditional tummy tuck operation does not typically involve liposuction because liposuction can decrease blood flow, can cause problems, and cause complications. However, I only do about 7 operations when I practice. I do them over and over again. So I figured out a way to do this operation in such a way that the blood flow is still maintained and I can still liposuction and contour the abdomen. Because I think what happens is the traditional operation gives a two-dimensional appearance. The belly is flat. It looks better when compared to the before picture. But when you look at the after picture, something tells you it doesn't look natural, like the way a young 20-year-old would look. With the 3D tummy tuck, I'm able to contour the abdomen and give it a three-dimensional contour that gives it a unoperated look, and also I'm able to keep the scar very, very low. And if you look at my website, you'll find many people with very, very, I would say, skimpy underwears, and you still can't see the scar.
Again, those are for just joining in. We're listening to Doc Talk Live. We're live in studios with Dr. Solomon discussing Mommy Makeover and plastic surgery. If you have a question for him, then join the conversation. It's 972-235-5555. Now, a very big question for you, Dr. Solomon. What are some of the complications that come along with getting a tummy tuck procedure?
Like one of the listeners earlier asked, complications I tell patients that can happen would be infection or bleeding after the procedure. To be very honest with you, I can't remember last one ever in the last 3 or 4 years ever had to go back or do anything for an infection or bleeding for that matter. It can happen. Patients have to be counseled, but it's not common for that to happen. It's probably a 0.5% chance or less of that happening. And anesthetic complications, obviously, in today's day and age, are very rare.
You're listening to Doc Talk Live. Please call 972-235-5555 to be the part of live show. We're waiting for your questions. Dr. Solomon, what type of scarring should be expected after a mommy makeover procedure itself?
Usually it's a very fine scar. It goes from hip to hip. It's just a little longer version of a typical C-section scar. And when it's closed by a plastic surgeon, obviously it's going to be fine. But obviously everybody's different. Some people tend to widen the scar a little bit. Some people keep the scar fine. But irrespective, the scar is so low and concealed that I've never really had anybody complain about it.
Let's take a live caller. Hi, you're live on Doc Talk Live. What's your question for expert?
So for things that they advertise on Total Best Solutions where they use some method to heat up the fat and dissolve it, how does that compare when you talk about the, I'm sure this is much more.
No, that's a great question. I'm sure a lot of our listeners are also thinking the same. Dr. Solomon?
Yes, so there are two, the way it works is that you can do just liposuction or some kind of a non-invasive technology to dissolve the fat, but you must remember the problems that happen with pregnancy are really twofold. First is you get excess skin, and removing fat or some kind of a non-invasive method cannot deal with excess skin. Second thing is a muscle problem. Most people get a muscle relaxation with a outward convex appearance as opposed to a natural concave pre-pregnancy appearance. Again, non-invasive technology and melting fat cannot address the muscle problem. However, there are some people where the muscle tone is good, they don't have much excess skin, and they probably have a little fat. In that circumstance, one of those options may not be a bad idea. And the other problem too is a tummy tuck is predictable. I can exactly tell you what's going to happen. I can almost guarantee you a result. While with some of the non-invasive techniques, I can tell you the fat is going to go, but it's anybody's guess how much it's going to go.
That's a great point you just made there. For those who are just joining in, you're listening to Doc Talk Live. We're live in studios with Dr. Solomon, plastic surgery, trained at Mayo Clinic. And we're talking about mommy makeover. So if you have a question, the number to the studio is 972-235-5555. Another question that we received is, when can you resume normal daily activities such as working out, driving, hiking after a mommy makeover? And is there a particular diet one should consume while recovering from the procedure?
Good question. So I have patients walk even the evening of the operation. I want them to be active. I tell them it's okay to climb stairs. For the first 10 days, they could have some pain because common activities like laughing, going to the bathroom, getting up, all involve the abdominal muscles. So when I tighten these muscles and put sutures there, all these common activities hurt. Having said that, my common response is when patients have an operation on a Thursday or Friday, take the next week off and you're back to work the week after.
Dr. Live, please go ahead with your question.
I have two questions.
Go ahead, please.
Do you have any procedure for stretch marks?
What's your second question?
The second question is, you mentioned about the tummy tuck, right? What if somebody wants to have a second kid? Will this tummy tuck work? If they want to have another kid, or will it?
Great question.
Sure. So first question, stretch marks. Any stretch mark, look in the mirror. Put your hand at the pubic area and put a second hand at the belly button. Any stretch mark between these two hands will be completely gone because all the skin comes out. Any stretch mark above the belly button gets moved down to the pubic area, so now it gets covered by the underwear. That's what the operation does. Any other stretch mark which is outside of these zones, you can laser or do something else to treat them. But a lot of the stretch marks are on the lower abdomen and they're completely taken out with the operation. Second question was with the child. My recommendation is don't do this till you complete your family.
Dr. Live, you're up in here. Please go ahead with your question.
One question, so after doing tummy tuck, does it also conceal the existing C-section scar?
Okay, so some people have a vertical C-section scar that goes from the belly button downwards to the pubic area. In those cases, I can completely remove the scar because that area of skin is completely removed. And I substitute that with a very low horizontal scar. With the typical horizontal C-section scar, I cut that scar out, but there's a new scar in its location which is slightly longer than that.
So far, everyone's been asking great questions. I know we spend 90% of the show talking about tummy tuck, and maybe that's just where Asians keep their fat. But I also want to give Dr. Solomon an opportunity to talk about other procedures that he does. So maybe, Dr. Solomon, you can touch up a little bit on who's a good candidate for maybe breast augmentation, and what are the different types of implant options, and do gel implants cause any problems?
Okay, so part of a tummy tuck is a breast operation, which could be either an augmentation or a reduction, which is making a larger breast smaller, or a lift where you don't increase or decrease the size of the breast, but really what you're doing is reshaping the breast and lifting it back up to where it should be. With an augmentation, you have gel and saline implants, and there was some bad publicity for the gel implants many years ago, but extensive studies have shown no problems, meaning they really don't cause any health concerns.
Dr. Live, please go ahead with your question.
Hi.
Yes.
Are we only specifically talking about tummy tuck, or are we also going to be able to address the chin tuck?
Go ahead, ask your question.
That's a great question. We'll refer this to over
I'm sorry, I didn't get that. So
chin tuck.
Oh, yes. So we can talk about chin tucks. I do that in my practice. I mean, in this case, I would call it a face neck lift, really. Now, in some cases, when somebody is young and they have a little excess skin under the neck, liposuction by itself is all that is required. As we get older, and maybe 45, 50 plus, and there's a lot of excess skin under the chin, then in addition to liposuction, some kind of a lift procedure, typically a neck lift, is required to reposition that, because it also involves correcting the underlying muscles. There are muscles in the neck as well that need to be tightened to get a good contour.
Dr. Solomon, will a cesarean section or hysterectomy affect mommy makeover results?
Now, a hysterectomy by itself should not affect the result, because in a hysterectomy, they can go back to the exact same scar that I made from my tummy tuck, or vaginally, and really they're just separating the muscle a little bit lower down, removing the uterus and closing things back up. But a C-section will affect results, because before a C-section, there's a pregnancy. So pregnancy can re-stretch the muscle that was tightened back together. And again, it's very hard to predict in any particular case where it's going to be, because some people can re-stretch and unstretch back to a sufficiently aesthetic result. Some people stretch out and may need to get tightened again. So that's why I recommend not doing this operation until you know for sure you've completed your family.
You're listening to Doc Talk Live. We're almost at the end of our show. Dr. Solomon, our listener will call 972-235-5555 if they have any questions. In the meantime, I wanted to ask, who is a good candidate for breast augmentation? What are the different types of implant options, and do gel implant cause problems?
Okay, so the best candidate for a breast augmentation is somebody who has a very small breast. You know, in today's day and age, body image is pretty important, and it's unfortunate sometimes when people have like A-cup breast size. Again, if it doesn't bother them, that's good. But many people have a lot of self-consciousness and body image problems. So you use a breast implant to augment a small breast to a reasonably larger size, say A to a C or a small D cup.
Great. We've had some great questions. I know we won't be able to get to all of them today. I know some of you are waiting on the line. Please go to our website, doctalklive.com, and also our Facebook page. You can see you can hear the whole show over again. And also make sure to go to our YouTube site, which is up. It's Doc Talk Live. Make sure to subscribe. We would love to have you on there, and you'll have access to all of our shows. Again, the website is doctalklive.com. If we didn't get to your questions today, please submit it on there. Dr. Solomon, you have about a minute left, or 50 seconds. Is there something you want to share with everyone, kind of summarizing what we talked about today, and then also share your contact?
Sure. So what I tell my patients, the most important is safety. This is an elective operation. It's not required. But there are many people who are significantly bothered by the way they look afterwards. So I would say safety is more important. I not only don't operate on overweight patients, I want patients to be in the right weight and medically fit before doing the operation. My website, solomonplasticsurgery.com, has extensive detail on the procedures, just about everything you want to know about. There are pictures and just about everything.
Great. Again, thank you for joining. We'll see you next Monday. Stay healthy, DFW.